What is going on, fam? Thank you very much for tuning in. Today, we're going to be talking about the types of therapy you can receive. Now, I do want to let you know, as I preface this video, is that I am slightly elevated, so my mood is hyperactive, hypomanic, because I have a comorbidity of ADHD with a combined presentation of hyperactivity and inattentiveness. And I also have bipolar 1 right now because of the change with daylight savings times and all this stuff. My circadian rhythm is completely off and my lymphatic system. So if I cannot get back to the point of what I'm trying to get out of this video, I do apologize in advance. But again, I really don't. I'm just saying that as a formality because I am slightly elevated, but I do want to give you some valuable content. The types of therapy that you should receive, whether you are a bipolar patient or an unbipolar patient, or you are somebody with depression, anxiety, addiction, substance abuse, maybe you have problems with your marriage or something like that. There is a spectrum of therapies you can get. A while back, I did a video on a woman named Shay who said that traditional talk therapy is bogus. I find that's total bullshit because if you mean to tell me that an executive coach or a life coach or a results coach or some bullshit fucking semantic marketer decides to proclaim themselves as I can help you get results by reading a book and then reiterating it to you, and you're just paying for the fact that you can say I have an executive coach, that's total nonsense. Because in my perspective, if somebody who has bipolar 1 on the severe end of the spectrum with a series of anxiety disorders along with ADHD, there is a lot that I personally have to handle alone. That no coach other than my psychiatrist and 2 therapists have to hold me accountable. But on top of that, I have to hold myself accountable as well and track my mood. The types of therapy that you need to do are really based on what your problem is. So if you have problems with your marriage, the question you have to ask is the problem you or the marriage itself? Because the problem's the problem. And that particular statement, the problem is a problem, is something that you're going to find more on solution-focused therapy. What is the problem itself? And move forward. Find the problem, fix the problem, move forward. That kind of stuff. Don't worry about the past. Find the problem, fix it, move forward. There's also family therapy. So meaning, what is the family structure at home? Brother, sister, stepdad, stepmom, half brother, half sister. You have to look at the dynamic structure of that particular hierarchy, if I can say that. The hierarchy. How is everything processed as a whole for either you, the parent, or for the kid? So if the kid is having problems, what's the family structure looking like? Or if the parents are having problems, okay, so is this the family as a whole trying to manage that, trying to be a new parent, or maybe you just don't know what to do? That is the question, family therapy. Couples therapy, generally couples therapy, that is going to be because the relationship is about to tip the fuck over. Somebody is on the verge of cheating, or somebody has already cheated. Either or, those 2 things, it's like hate and love. There's no in between. You can't be half pregnant. Someone's about to cheat or someone's already cheated. And that's generally where couples tend to have their therapy, because I've yet to see a couples therapy where there is not an emotional problem intact. Generally, when it comes to couples therapy, there's emotional problem intact. And I do want to preface this video. This is by no way, shape, or form any way for me to tell you or dignify what therapy you should take. I'm just giving you a spectrum of therapies, and I am not a clinician. I just want you to not think that all talk therapy is the same. The next thing that we're going to look at for children is play therapy. Play therapy is essentially going to be a child acting out with their creative mind a play-by-play scenario to fix a problem, or how do you respond to a problem? What is the reaction to the problem? How do you overcome that situation in play therapy? DBT therapy and CBD therapy, shit, I cannot control the racing thoughts, are DBT therapy is something that is like a 2-hour therapy with mindfulness based, and CBT included. CBT, dialectical behavior therapy, and cognitive behavioral therapy is your traditional talk therapy, bare bones. How do you change the way you think, act, and feel? That's CBT, bare bones traditional talk therapy. DBT is mindfulness, assisting with splitting, generally with like complex post-traumatic stress disorder. And then you have how to see the gray when there's a black and white splitting, kind of like half pregnant. How do you see that shades of gray? Either or. And then with that, it's also based in a group setting. So it's something that's tailored more for borderline personality disorder, but it's also very good for those patients such as myself who have bipolar disorder, because when you split or you have a PTSD comorbid diagnosis like I do, and I split because I've caught myself doing it, how do I stay grounded when I'm either hitting that depressed or manic state? That is the question. When I have my panic attacks, how do I stay grounded? Another thing that you can also look at is EMDR therapy. EMDR is eye movement D. I can't even think of the D right now. Whatever the case may be. Eye movement something therapy, because my mind is going 100 miles per hour. EMDR therapy is essentially trauma processing therapy. So if you have a PTSD diagnosis and it's very complex. So for example, when there are sudden movements around me, I'm always under the assumption that somebody's going to hit me. Whenever somebody is in a very angry tone of voice, for some reason I tend to split and I get in a fight or flight mode. I've caught myself doing that, being mindful. And that's the thing with EMDR is, how do I, kind of like in a dream, lucid dreaming, while you're conscious, try to get you to process that information when somebody's doing this back and forth and they have clickers in your hand and they're essentially trying to put you in this state. It's like a conscious hypnosis, if I have to call it. The other two therapies that you can get are biofeedback, which I know very little information about, and then electroconvulsive therapy. Electroconvulsive therapy is going to be something where you're put in anesthesia and you're essentially given a bite guard, and then somebody shocks your brain, kind of like a psych ward. They shock your brain to get you out of depression. That is essentially when you're so severely clinically depressed that the medication they give you there's a resistance against it and it doesn't work. So they need to shock you out of therapy. The only problem is that you may end up getting a lot of severe side effects like memory loss, and you're fucking clueless on what's going to happen. And last but not least, there's also medication management therapy, which you're going to see exclusively with a psychiatrist. Now that is a lot of information for me to put out there. With that being said, your medication management therapy, anybody can get medication management therapy, but in my opinion, I believe it would be much more feasible for you to go get a psychological evaluation done, in my opinion, to see exactly what your problem is currently. Because if you're having current depressed episodes, it could be major depressive disorder that's recurring, or it could be bipolar depression. So when you get put on an antidepressant because you ask your PCP, hey, I'm depressed, can you give me an antidepressant? They give you an antidepressant. And when they give you the antidepressant, you go in a fucking manic state, and then you end up in the same situation I did. That's exactly why you should always find a mental health provider. And that's a lot because, again, pressure speech, hypomanic, I'm completely aware. Anyway, guys, I hope you liked this video. If you have any questions, comments, and concerns, make sure you hit me up. You can follow me on Facebook, Twitter, Instagram, and now Pinterest, Tumblr, LinkedIn, and TikTok. Until next time, guys, stay tuned. Take care.